Welcome to your weekly pulse of wellness. I am your host, Tobi Adetayo, a dedicated sport physiotherapist with a passion to helping you live pain-free, healthier, and a more vibrant life. Whether you're bouncing back from an injury or looking to level up on your fitness journey, this podcast is a one-stop shop for expert insights and practical tips. Every episode will bring to you science-backed strategies to helping you live better, feel stronger, and thrive every day. On today's episode, we'll be talking about an important part of the society that people have neglected, although it's booming these days, it's exercise. Exercise is medicine. Exercise is medicine. And on this episode, I have with me a professional, a sport and orthopedic physiotherapist. Physio Olatubi Olawale will be joining us today to share more light on why exercise is medicine. Physio Olatubi, are you with us?
Yeah, good afternoon, good morning, good evening from wherever you are listening to me. Welcome to this wonderful episode. My name is Olatubi Olawale, a sport and orthopedic physiotherapist with over a decade of practice. Also been specialized in mental health, in a way, working in mental health. Presently, I'm actually in the field of mental health, and I'm trying to see the extent of which exercise can be important in our mental health also. So, but today we're talking about a very important topic. Exercise is medicine.
Thank you very much, Physio Olatubi Olawale. It's nice to have you here. I know your time is important, so we'll get straight into it. When we say exercise is medicine, what exactly are we talking about?
Okay, the idea about exercise is medicine is that it's just to make sure that regular physical activity is because it's been proven that regular physical activity is one of the most effective and the safest way to prevent and treat chronic diseases. So exercise is medicine. It's an initiative by the American College of Sports Medicine. So which the aim of the initiative is to encourage healthcare professionals like physiotherapists, doctors, from any as far as an healthcare professionals. What we need to do is to encourage and prescribe exercise the same way we prescribe drugs or medications. So because movement is more powerful, is a more powerful medicine for the body and the mind. So exercise medicine is generally just trying to prescribe exercise, physical activity to clients or patients the way we prescribe drugs. So when your doctor or your pharmacist prescribe drugs for you, they tell you use this one morning and afternoon, or do this kind of use this medication morning, afternoon, or 3 times daily. Same way we can also prescribe exercise. Do this kind of exercise morning, afternoon, evening, and that kind of thing. So that's all the aim of exercise is medicine is.
All right, thank you for that. So you mentioned regular exercise to be prescribed like medicine, like drugs, right? So how does regular exercise help prevent serious conditions, say heart diseases and diabetes?
So for heart diseases now, major heart diseases we know, exercise when you exercise regularly, it helps to improve your blood circulation in a way, because one thing about exercise is that regular exercise has a way of strengthening the heart muscles so that it can pump blood very well. So in a way, if your heart muscles are stronger enough, it pumps blood better and stronger. So in that way, it prevents any heart diseases or cardiovascular diseases. Another way it's also very, very good is also that exercise or regular physical activity is also good in reducing bad cholesterol in the body. We have two kinds of cholesterol, the LDL and the HDL, the low density lipid, which is a bad cholesterol. So when you exercise regularly, it reduces the bad cholesterol and also increases or raises the good cholesterol. And also, regular exercises also clear the fat deposits from the arteries. When there is fat deposit around the arteries, it causes blockage of blood circulation. We call it atherosclerosis, where there is not enough blood supply to the brain or to the body. So it can lead to cardiovascular diseases like stroke and heart diseases like heart attack. So that's another way where exercises can prevent chronic heart diseases. And also, it also helps you to reduce your blood pressure. Regular exercise has also been proven, especially the aerobic exercises, has also been proven to help you improve the elasticity of the blood vessels. So when the blood vessels are being, when it's more elastic, and when it also decreases the resistance of the blood flow, in that way your blood pressure is regularized, is better. So that is how exercise has been proven to reduce heart conditions.
All right. That's very insightful. So
Thank you.
you've been working in mental health for a while now. Can you say exercise really improve people's mental health, like anxiety and depression?
Yes, so the goal of physiotherapy or exercise in mental health is very, very important, in the sense that exercise, one of the major things exercise does is that it makes you feel good. When you exercise regularly, it releases these they call them the feel good hormones, the endorphin and the serotonin. When you exercise regularly, it helps you feel good. You exercise, you want to do that again, and in that way, it makes you okay. So it makes you okay. And also, there's this kind of hormone, we call them the stress hormone, the cortisol hormone. Exercise helps to reduce that stress hormone when you exercise regularly, because a lot of people are going through stress, which can lead to depression. So when your stress level is being reduced, the cortisol level is reduced, increases the endorphin and the serotonin. You feel good, you feel better, you feel relaxed. In that way, you're okay. Another way, exercise is also very, very good in mental health. Or it sees that we have some patients or some clients whereby we are trying to wean them off drug, maybe drug abuse, and we're trying to wean them off drug, and we recommend exercise as a substitute to the drugs they are taking, substitute to the drug abuse. So we tell them, instead of you taking this drug makes you feel good, right? Why not you exercise? Exercise also will make you feel good.
Hmm.
So it's just substituting one for one. And we've had positive remarks whereby clients say, oh, and when I start exercising, I start feeling good. I don't even think about taking this drug that gives me the feeling. So we tell them that the same feeling you want this drug to give you, exercise can give you the same feeling. And they try it and they see it and it's effective. So exercise and regular exercise is very, very important in mental health, and to reduce your stress level, reduce your depression, anxiety disorder, everything, even for drug abuse, very, very important.
Hmm. Thank you. Who would have thought that exercise can do as much benefits like this to people? That's good.
Yes.
So these days, right, we have seen the surge of people working from home. We have seen people, the bankers and things like that, deal with back pain and all sorts of things. Can you say exercise help people recover from this kind of injuries or manage chronic back pain?
Yes. Now, it's been proven also, because we would not say anything unless it has been proven. And when I mean proven, proven by research wise, and even with my own years of experience, I would not, at least over spending over more than 10 years in this field, I've been able to see a lot of conditions, and I've been able I can actually say something based on my experience. Yes, exercise has been proven to help you reduce any kind of pain, low back pain, joint pain. Exercise has been proven to help you that. One thing about exercise is, one thing about low back pain or um, all this joint pain is that sedentary lifestyle increases your pain. When you are always in one position because of pain, I know, because some people say, I'm in pain, I cannot exercise. I'm in pain, I cannot, let me just stay in this position. The truth about it is that the more you stay in that position, you're even causing more damage and more harm to yourself.
Hmm.
So it is always advisable to at least be active. The moment at which you are trying to be active, you are strengthening your back muscles. You are trying to move the joints. The movement of the joint helps in bringing down the pain, which is better than you not exercising at all. So yes, for issues like this, like okay, you come to see a physiotherapist. One of the major things a physiotherapist will recommend for you or will do for you is physical activities, exercises. Do these exercises, do this. No physiotherapist or no medical practitioner will tell you to sleep or lie down because you're having back pain or something. So yes, exercise has been proven to reduce joint pain and back pain. And people working from home, the rate at which they have had increase in low back pain because of sedentary lifestyle, sitting in one position for too long, not moving around. And the funniest thing about it is that the seat or the chair they are sitting on, it's not even conducive. They sit in a very awkward position, especially people that work from now. Most of them, they don't even sit on a chair. They sit on their bed. Sitting on the bed, pressing a laptop for hours without even doing anything. So when you sit on your bed without having a backrest, by the time you stand up after 5 or 6 hours, you come down with a lot of back pain. So even if you are sitting on a comfortable chair or a bed, it is always advisable for you to get out of the bed or get out of the chair every 45 to 1 hour. Move around, change the dynamics, and you feel better. So yes, exercise has been proven to reduce low back pain.
All right, thank you very much. So, as we age, as we grow old, there are certain conditions that tend to creep in. Conditions like arthritis, high blood pressure, posture imbalance, or posture deformity generally. Can exercise help us solve these things or prevent old people from having these kind of conditions?
Yeah. So before I go further and with your question, I would just like to chip this in, which is the principles of exercise in medicine, actually, which is actually, before we talk about exercise, we need to know the frequency of which exercise is being done. Now, it is being recommended that at least according to WHO, they tell you that at least 30 minutes of moderate exercise for 5 days, at least 5 days in a week is okay for you. So now, frequency, the interval of exercise. How often are you to exercise? Is it every day? Is it 2 times in a week? Is it 3 times in a week? Then also we talk about the type of exercise. Now we cannot talk about exercise without talking about the type of exercise. We're talking about, is it the aerobic exercises, which involves swimming, jogging, walking? We talk about the strengthening exercises, because some people just go to the gym without knowing what kind of exercise they want to do. Some people just what do you want to train for? Do you want to train for your cardiopulmonary endurance? That's where aerobic exercise comes into play. Or do you feel like, okay, I need to grow more muscles? That's where strengthening exercise come into play. Then also we have the stability and balance exercises, which is very, very important. We also have the flexibility exercises, which is also, so the type of exercises is very, very important. The frequency of the exercises, how often do you exercise? Then the interval of exercise is very, very important. So that's why we also call them the principle of exercise is medicine. So now when I'm talking about prescribing this exercise, now I'll tell you that, okay, Mr. A, you have to do aerobic exercises 3 times in a week for 30 minutes. That is how to prescribe exercise. Now, for people with geriatric condition, now back to your question now. With geriatric conditions and they're having issues with osteoarthritis, issue with balancing and everything. First thing is this: you come to see the medical practitioner, the physiotherapist, or the person that is trained in exercise. When they see you, they examine you. They told, oh, what is the issue? Is it issue with balancing? They will prescribe balance exercises for you, stability exercises for you, just to strengthen the muscles around your joints. Very, very important. And also people with osteoarthritis, knee osteoarthritis, exercise has also been proven to help you reduce the osteoarthritis. One of the major ways is fine, weight reduction. We know that one of the major causes of osteoarthritis or joint pain is weight, overweight. When we try to help you reduce your weight with exercises and dieting, it reduces the pressure on your joints. Weight reduction. Then also, apart from weight reduction, we talk about strengthening of the muscles surrounding the joint. I'm going to use the knee joint as an example. When you're having issues with your knee joint, we recommend exercises that we strengthen your quadriceps muscle, we strengthen your hamstring muscles, we strengthen your calf muscles. In that, whereby when you're walking or when you're moving around, when the muscles around the joint are being strengthened, the load going to the joint is reduced. In that way, you feel better. Another way exercise can also work for joint pain is also movement, regular movement, free active exercises, movement. When you move the joint, it brings synovial fluid to the joint. It makes synovial fluid go into the joint. In that way, there is more movement around the joint. There is no stiffness in the joints. That is how exercise is actually being good for joint pain.
I love how detailed that answer is. So it gives the layman an avenue to see exercise as not just carrying weight and things like that. Exercise has to be prescribed, has to be targeted, has to be measured as well. Thank you. So moving on, how does okay, let me say it this way. If someone is too busy and maybe feeling unmotivated, how do you think they can start the lifestyle of exercise?
All right. So now, the motive, when I tell people start exercise, they'll tell you, I don't have time. Oh. I cannot be going to the gym. Oh. I cannot be doing this. And that's true. One thing about it is that you don't have to go to the gym for you to be physically active, for you to exercise. The best form of exercise or physical exercise is walking, brisk walking. Brisk walking. So if you are too busy to exercise, if you can do a lot of things, if some people have their cars, they drive from their house down to the car park, to their office, in front of their office, they come down and the car is just in front of so they don't really even walk at all. I encourage you people like that. So what I used to encourage for such people is that I advise you always find a way to park like somewhere far away from your office. Park there, walk. When you walk down to your office, walk back. That's an exercise. And also, even walking around, you can give yourself a target. Okay, you have a timer on you have a step counter on your phone or your smart wristwatch. Okay, today I must achieve 10,000 steps today, or let's say to start from like 3,000 steps today. 3,000 steps in a day. It's very, very effective. You're moving around. That is also very good for exercise. Even physical activities, doing things inside the house chores can be classified as exercise. Moving around, doing things in the house, as far as it's not stressful, it is exercise. So you don't have to be in the gym before you say you want to exercise. Just moving around your house. You can just say, okay, dedicate 10, 15, 20 minutes in a day. Let me just move around. Let me just walk around. You can just pace around your office. Walking around your office, it has done the work you need to do for the day. That's why WHO has already said it, at least 30 minutes of moderate physical exercises is okay for your heart, at least for 5 times in a day. So you rest for 2 days and you're okay. So regardless of your busy schedule, incorporate exercise into your daily activities. Yes, and when you incorporate exercise into your daily activities, then you are good.
Nice. So exercise can just be like a daily habit, like the way we brush our teeth, the way we wash our
Yes.
just
Put it so
incorporate it.
incorporate it into your daily activities and you see that you're fine.
All right, thank you. So how can exercise lead to healthier eating and lifestyle habits?
Okay, so for lifestyle habits and healthier eating, the thing is about is that, sometimes when you have the urge to eat, because most of the people who eat unhealthy or unhealthy is the fact that there's this hormone in the body. I can't remember the hormone that gives them this urge to always want to eat. Now, exercise can also substitute that urge to eat. When you are always having this urge to eat, incorporate exercise into it. You see yourself that, oh, I'm not eating now. I don't have this urge to eat unhealthy food. Let me instead of that, let me exercise. So exercise has also been proven to help you curb unhealthy eating. So when you have to eat anyhow, eat this one, you won't have the time to eat. And also, even if you eat it, exercise helps you burn these calories. You understand? You've been able to eat them, okay, fine. When you exercise, you're able to burn the calories. So that's how effective exercise is also. So the major primary thing about it is that it helps to reduce the urge to always want to eat when you exercise. So substitute exercise for eating at your poor eating habits. The same way we are substituting exercises for drug abuse, the same way you can substitute exercise for poor eating habits.
All right, thank you. It's been an insightful episode talking to you. But before we leave, can you give us one takeaway that you want our listeners to remember about exercise?
So the takeaway I'm just going to give you is that you are not too busy to exercise. Involve exercise into your daily activity, because daily or regular exercise, as it is the safest and the less expensive way to prevent chronic at chronic diseases. That's just take home. Thank you very much.
Thank you, thank you, thank you for your time. Thank you so much.
You're welcome.
Olawale has really done justice to today's episode. Our appreciation is to him for sparing this time with us. Join us on our next episode of Pulse of Wellness, where we bring to you science-backed strategies to helping you live healthier, pain-free, and a more vibrant life. Ciao, ciao. Bye.